The purpose of this training is to increase awareness for faculty, staff, and administrators of common challenges facing student veterans, as well as some resources that are available to help. We will cover classroom accommodations, mental health resources, education benefits, and other resources. While we will cover these topics briefly, you can click on the links in the video for more information. Before we get to problems facing student veterans, we should take a moment to highlight their strengths. Student veterans can be an incredible asset to a classroom and a campus. Student veterans have real-world experience completing difficult tasks and have often developed strong leadership skills as a result. They are used to working as members of a team and solving problems in an intense, fast-paced environment. Many veterans have traveled the world and interacted with diverse populations and can bring that experience back to your classroom. Some, not all veterans, come home having had experiences that make their new roles as students more challenging. They've worked in dangerous environments. In some cases, they've become habituated to sleeping whenever and wherever they could. They've carried gear and put their bodies through a tremendous amount of physical stress. Some veterans have experienced multiple forms of trauma. Trauma may not be limited to combat soldiers and transcends military experiences and positions. Trauma can include military sexual trauma for men and women, as well as being exposed to stress and environments far outside the scope of a traditional college student. A student veteran in your classroom may be dealing with any or none of these illnesses in a given day. A student veteran may have doctor's appointments, medications, and other health needs above and beyond what a typical college student experiences. For some veterans, transitioning to student life after leaving the military appears seamless. Other veterans require additional support. Soldiers are taught that asking for help might mean letting the unit down, which can lead to a reluctance to ask for help when they come home. Veterans are coming from an environment with a clear mission and comrades to help them achieve it, and are transitioning to a student lifestyle that is significantly less structured. Some veterans are learning to create an entirely new identity outside of their military role. These are some of the accommodations that have been shown to increase student veteran abilities to succeed in a classroom setting. These accommodations are sometimes necessary to compensate for deficits that occur as a result of medical concerns, traumatic brain injury, or mental health challenges. If you notice a student struggling during testing or having difficulty attending to lecture, it might be helpful to connect that student to your school's Disability Accommodations Office. Some student veterans may need to miss multiple class sessions due to medical appointments at the VA. They might require more flexibility around classroom behavior, such as seating considerations, or being allowed to stand in the back of a hall during a lecture. VITAL, or Veterans Integration to Academic Leadership, is a VA program currently running out of 26 VA locations around the country. VITAL staff go out and meet student veterans on college campuses, effectively bringing the vast resources of the VA to where student veterans need them most. VITAL staff can help with referrals to disability accommodations, mental health resources, tutoring, and all manner of paperwork and benefits applications. There are a number of education benefits that the VA provides to returning student veterans. Occasionally, student veterans need help applying for these benefits. Some student veterans may not even realize that they qualify. Click the links on this page to be directed to additional resources on the GI Bill, housing allowances, textbook allowances, and vocational rehab. If a student veteran comes to you with tuition or housing concerns, these may be benefits that can help. Many veterans come home having suffered no adverse mental health effects. Other veterans suffer, to varying degrees, from mental health challenges such as post-traumatic stress disorder, anxiety, or depression that may have been caused or exacerbated by their military service. There are many evidence-based treatments available for veterans who are struggling. If a student veteran discloses a mental illness, or you suspect that a student veteran may be struggling, it's important to know that there is help available. Student veterans can be referred to campus counseling services. Many schools have a veteran representative or a VITAL staff member on campus. Every town in Mass has a Veterans Service Officer who can refer veterans to resources. Click on any other of the links above for additional information. Thank you for taking the time to watch this video. If you have any questions or require additional information, the Bedford VA Vital contact is Elisa Bennett, and she can be reached at the telephone or email address above.